The College of Physicians and Surgeons of BC and the College of Pharmacists of BC are teaming up to circumvent a Health Canada rule and are pushing to allow pharmacists to distribute a new two-step abortion pill, despite a Health Canada policy stating only physicians be allowed to prescribe and dispense the drug mifegymiso. Abortion advocates insist this is likely to make physicians unlikely to dispense the drug because most doctors' offices are not set up to be mini pharmacies. But Health Canada fired back, insisting that it's much safer for the health of women if physicians distribute the drug, as is the practice in every other country the drug is currently available in. The aforementioned colleges in BC believe that they have found a loophole that allows them to work around the Health Canada rule, and it could allow other provinces to follow suit. Basically, if a physician prescribes the new drug as something known as off-label, they can avoid Health Canada's restrictions. Off-label is when doctors prescribe a drug for a condition it was not originally intended to treat. Health Canada responded to a letter from the two colleges saying they would be free to proceed with their idea despite the federal drug regulator not agreeing with their method, but they did warn any physicians that they would be accountable for these decisions as a matter of professional responsibility. Mifegymiso is made up of two different medications sold together. The first, and I do apologize if this is tough to listen to, called mifepristone, blocks progesterone production, causing the lining of the uterus to break down. While the second drug, misoprostol, is taken 24 to 48 hours later and induces contractions similar to a natural miscarriage. The drug has been available outside Canada for a number of years. However, in France, patients can only obtain it from a doctor, and 5 separate doctor's visits are required. In Canada, it's only 2. And like any pharmaceutical, there are side effects. In rare cases, pregnancy can continue after taking the drug and can result in significant birth defects to the child or cases of blood poisoning. This whole topic around abortion even makes me, a secular, non-religious person, uneasy. For me, I believe that life begins at conception because that's the way I look at the science. But the bigger issue is the fact our country has the worst laws, or should I say lack of laws, in the free world regarding abortion. In 1988, abortion was removed from the criminal code, allowing even late-term abortions to be performed in our country, something even the most left-leaning social democracies in Europe don't allow. And now we are making it even easier with this attempt to circumvent a Health Canada rule, one Health Canada doesn't even seem to want to uphold. Now, I do want to make clear, in cases of rape or incest, I think a new drug like this or the morning after pill are okay. But perhaps being pro-choice should mean choosing contraception before having sex instead of choosing an abortion afterwards. Or perhaps choosing to allow a willing, caring, and loving family to adopt the child instead of choosing to end a new life. For the Rebel.media, I'm Christopher Wilson. Hey, thanks so much for watching. Make sure you never miss a video by clicking subscribe on our YouTube channel. And if you really liked what you saw, well, click up here to become a premium member and check out all our full-length shows.